A lot of what you spoke about just then are the principles of cultural competence. So that diversity of perspective and being able to consider that when you're talking to somebody, being sensitive to, aware of, and happy to adapt to cultural differences. That is all part of being culturally competent. And seeing a culturally competent teacher, police officer, mental health professional, therapist, whoever it is, can really transform your experience. I love what you said about use a patient's own words, because I really don't think we do that enough. And it's something that actually hammering into us in medical school recently. Do they use the word, depressed? Did they use the word seizure? Did they use the word unhappy? Were they crying? What did they describe? And write that down word for word. Repeat it back to them. Ask them questions. And I think a really important part of cultural competence that I think a lot of people aren't comfortable with is being inquisitive. You can ask questions. You can find out more. I think more resources do need to be available in terms of learning about, for example, and also an encouragement of learning about cultures, from religion to racial differences. I mean, look at what food they eat if you want. As a doctor, that could be really, really helpful, for example, in a diabetic
Yeah,
clinic where people eat different
absolutely.
food. I mean, it has amazing effects for everyone. And I think that I wish there was more encouragement to ask those questions. And if you're not comfortable to ask them to a patient because they're also not there to educate you if they don't feel like it, go and look things up. And that's absolutely fine.